Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you today with the Common Sense Doctor. I'm going to try to make common sense out of a question a lot of people ask me about vitamin K. You know, I recommend that everybody takes vitamin D. Um, but for adults and really anybody over age 30, certainly 40, you need D with K, meaning vitamin K. Now, there's different forms of vitamin K, and that's kind of what I want to explain today. I want to make something simple out of really something that's very complex. Because when you do a deep dive and you start looking into organic chemistry and decarboxylation and positive and negative charges and calcium influx. I mean, it gets pretty deep. But I'm going to make something out of this I think will be kind of simple and some common sense things to do with vitamin K, because you do need vitamin K, hopefully with D as well. Because let me tell you first where vitamin K comes from. It's one of those fat-soluble vitamins. Remember, A, D, E, and K are fat-soluble vitamins. They need fat to work in your system. They work much better with fats. But vitamin K, not to be confused with potassium. A lot of people think I'm talking about potassium when I say vitamin K, but potassium is actually KCl. Potassium chloride. It's totally different. That's a mineral. This is a vitamin. Vitamin K is what we're talking about. Remember that. But it's a little bit different than some of the other vitamins in that it's a coenzyme, which means it's required for other reactions to take place in your body. And it turns out vitamin K, it comes from a German word meaning coagulation. They spelled K with a K. So it comes from a German word, coagulation, meaning stopping bleeding. So it does affect your clotting factors. It's very important for this, as we'll talk about in a minute. But remember, it's a fat-soluble vitamin. Your body really can't store a lot of vitamin K, but it does recycle in the body. But it turns out you do need vitamin K from your diet or a supplementation, preferably both. So there's different forms of vitamin K, and people always ask me on the Q&A session on Tuesday nights, you know, what form of vitamin K should I take? So I'm going to go over that with you. It turns out I think you probably ought to get a combination, but there's one above all that works the best. And that's vitamin MK7. And I'll explain that to you. So there's three basic forms of vitamin K. K1, phylloquinone. Now this comes from plants and green leafy vegetables, which you should be eating anyway. Matter of fact, you can get enough of this just by eating green vegetables. Vitamin K2, which is really the important one and one that does all the work. Now it comes from animal sources, especially fermented products and liver, and also your intestinal bacteria they make this stuff. So it's very important that you have gut balance that we always talk about. And it turns out and then there's vitamin K3, which you don't need to remember much about. It's called minoidone, and it's a synthetic form of vitamin K that's water soluble. And it's not really even used here in the United States, so don't even worry about it. Just think about K1 and K2, and think mostly about K2, because that's the one you need to supplement with. And it turns out that there's a lot of different forms of vitamin K2. As a matter of fact, there's vitamin K2 through vitamin K14, and has to do with the number of 5 carbon units on this molecule. Like I said, this goes pretty deep, so just remember the main points that I'm making. So the main form of vitamin K2, turns out, is probably MK4 and MK7. And MK2 possibly, so don't worry about that one. But it turns out that the vitamin MK7 is very long acting, if you think about taking MK4, which is the other one, if you look deeply at your supplements, it's one it's going to be. As a matter of fact, a lot of supplements have a combination of K1, K2 in the forms of MK4 and MK7. If you're a purist, you'd probably just eat green leafy vegetables to get your K1 and take MK7 alone, because that's where all the money is. It's the workhorse of the vitamin K2. It has such a long half-life, and it tends to work for bones better. There's probably not as many studies on MK7 as MK4, but in all the research I've done, I think MK7 is where the money is. And I don't mind if you get a combination of all. The one I'm taking right now has them all in it. I'm thinking about switching just to a pure MK7 at some point. So you have to look at, the quality of your supplements and what else it may have in it, including fillers. MK7. Now, what does it do really? It actually acts on your platelets. It attaches to your platelets to form thrombin, which helps stop bleeding. That's why they call it coagulation. Certain medications block the action of vitamin K, like Coumadin, warfarin. If you're trying to get your blood really thin because of a condition that you may have, like a mechanical heart valve or maybe even atrial fibrillation. We're getting away from using a lot of Coumadin. We have some new blood thinning medicines like Eliquis, that won't interfere with vitamin K. So that's something that's really hopeful. But so vitamin K is known to help your blood clot, but that's not the only reason that you want to take this vitamin K. As a matter of fact, it's not the most important one in my mind. It's really to help the vitamin D bring the calcium into your bones, not your arteries. Think plaque. It also has a very direct effect at protecting your endothelial lining. Turns out it has a lot of beneficial effects for your heart. And it also helps bring that calcium out of your joints into the matrix of the bone that you want. So it helps bleeding, it helps bone formation, and it prevents vessel mineralization, like calcium deposits in your vessels, which is bad. That's one reason you should get a cornea calcium scoring and see how much of that calcium plaque that you have in your arteries of your heart, your coronary arteries. So it's a really, really important vitamin that a lot of people don't even think about. They don't, much less think about the forms you're taking. As a matter of fact, to prevent bleeding, it's required in every newborn. When you're a baby, as soon as you're born, you're going to get a shot of vitamin K. That's vitamin K1 that they're giving you intramuscularly. You're not going to remember because you're a newborn. But they give every newborn baby here in the United States a shot of vitamin K as soon as they're born to prevent bleeding, especially of the brain. Turns out that vitamin K is not too well transported across a placenta, and there's none in the milk, in breast milk, and some other factors as well. But every newborn baby needs vitamin K to prevent bleeding. So there's a lot of things about vitamin K, when you should and when you should not take it. There's really abnormal clotting is not related to excessive vitamin K intake. So remember that. There's really no known toxicity of vitamin K1 or K2, but large amounts of vitamin K can overcome the anticoagulant effects of vitamin K antagonists like Coumadin, warfarin. So you want to take that into account, and you check your prothrombin time. Remember, that's what it's doing. Is vitamin K is forming prothrombin to help clot your blood. So certainly, if you're on any vitamin, you need to watch your pro time. If you're on Coumadin, if you have to be on Coumadin. Symptoms of low vitamin K, which improves your clotting. bleeding gums, easy bruising, nosebleeds, blood in your urine or stool, or dark tarry stools, heavy menses. Really, it's not as common in as adults as you might think. Like I say, all newborns really need this. Other places you may see it, low vitamin K, is those people that get on a low fat diet. We do not like low fat diets, but if you're on a low fat diet, you may be very well may be low in vitamin K. If you have fat malabsorption, if you have liver problems, you may have problems with deficiency in vitamin K. Inflammatory bowel diseases are notorious for this. Cystic fibrosis, like I say, newborns. So if you find yourself bruising too easily or bleeding, you may think about taking some vitamin K. It's essential anyway for the reasons that I've mentioned before. But and I currently do take a life extension vitamin that has K1, K2, and it does have the MK4 and MK7 in it both. If you're a purist, you'd probably just eat green leafy vegetables and take MK7 at a dose of about 180 milligrams. MK7, it really comes from Japanese fermented soybeans. They call it natto because it's very rich in MK7, and that's where most of the really good supplements come from. So if you're a purist and want to, take your vitamin D separate from your vitamin or K from your D, then you might want to go with an orthomolecular product with that. But other things you got to know: large doses of vitamin A or E could affect or interfere with your vitamin K, so you got to be careful with this. Greater than 1,000 milligrams or units of vitamin E may interfere with that. Vitamin E is something you have to be careful with thinning of your blood, as well as omega-3s, fish oil. So you got to be careful of that. You'd have to have a pretty good dose of vitamin A to worry about it, I think. So people that are on Coumadin definitely need to watch out for this. And definitely, if you take K, you should not take vitamin E anyway. Drug interactions besides Coumadin or warfarin, you got to be careful with anticonvulsants like Dilantin, which we don't use a lot anymore for seizures, at least I don't. Anti-tuberculosis drugs like rifampin and isoniazid, which are uncommon drugs. Amiodarone, which is a cardiac arrhythmia drug you don't see a lot of people on that one, a lot of interactions. But also some of the cholesterol-lowering drugs like cholestyramine, which affects the cholesterol absorption from your gut. So think about that one. And also the fat substitute Olestra that gives everybody diarrhea that nobody takes. Think about that can affect your absorption of vitamin K. There's a lot of other things that vitamin K probably enhances. I know in some animal studies it increases testosterone. And it definitely has some cardiac and life-extending properties to it. So if you're an adult and you're not thinking about vitamin K, you really need to add this to your regimen. With the previously mentioned interactions that are rare with those kind of drugs. But so think about protecting your heart, think about protecting your bones, making your vitamin D, make the calcium work better, and think about protecting your vessels from calcification. So think about vitamin K, especially vitamin K2, which has the longest, and MK7 definitely has the longest action. You just need one of those a day. It's not affected by a lot of other stuff. So I hope this helps you. Vitamin K. Hope this is a short little summary of it. If you have any questions, please don't hesitate to contact us at performancemedicine.net or come in and talk to us personally about this or any other vitamin, supplement, medicine, or lifestyle. Because what you want to do is prevent things before they occur. Thank you. This is Dr. Tom Rogers at Performance Medicine.